Hello everyone, my name is Rodrigo. I'm the co-host of Archie Friday session, and it's my pleasure to welcome you to this new Archie Friday. Today's topic is architecting real-time clinical communication for better patient outcomes. In healthcare, as you know, every second matters, and this session will highlight how real-time communication can transform clinical coordination, improve care quality, and ultimately save lives. Together, we will explore the impact of secure messaging and instant alert systems, concrete benefit in critical care and emergency settings, the technical and regulatory challenge of integration and compliance, and finally, a practical roadmap for successful deployment. Before we begin, a quick note, please type your question in the chat during the session. Our speaker will take the time to answer them at the end of the presentation. To guide us through this essential subject, I'm honored to introduce Akhilesh Bolan, a recognized expert in clinical communication system and healthcare innovations. His insight and experience will shed light how technology can truly improve patient outcome. So, welcome Akhilesh. The
Thank you.
floor is yours.
Yeah, thanks. Um, yeah, hello everyone. This is Akhilesh. So first of all, a big thanks to Roderick and Seme for giving me this nice opportunity. It's privilege to present at Archie Fridays. So big thanks to both of you and the team behind it. Um, yeah, so I'm Akhilesh Ballam, a senior software engineer with over a decade of experience building cloud native systems and real-time communication platforms. Most recently at Amazon, I worked on large-scale systems that power Kindle content sharing and annotation experiences and Alexa integrations for Fire TV systems. So, which must stay highly available and consistent across millions of users worldwide. Before that, at Oracle, I worked on delivering clinical solutions designed to integrate EHRs and enabling real-time messaging and alerts for frontline medical staff. Um, Also, earlier in my career at Infosys, I worked on insurance and healthcare claim platforms, gaining early exposure with regulated high-stake environments. Uh, so across these roles, one lesson that really stood out for me was whether it's synchronizing millions of ebooks or delivering life-saving alerts to medical staff, communication is the key. It's not just an add-on. Um, that insight led me to today's topic, how to architect real-time clinical communication for better patient outcomes. So, as you all know, healthcare today moves at an extraordinary pace, and the communication that supports it has to move even faster. So, in clinical care, every second matters, and delays aren't measured in minutes, they are measured in consequences. So, even a small lag in getting right information to the right person can shift the outcome from a timely intervention to irreversible harm. So that's why the session focus on architectural principles behind real-time communication in clinical systems. Specifically, we will explore a set of architectural principles and real-world lessons for building systems that deliver secure, instant, and reliable clinical communication. We can also look into some of the technical patterns that make low latency messaging possible and some of the security and regulatory standards that need to be considered to keep the patient data safe and some of the deployment strategies that help hospitals adopt these tools without disrupting the existing care. My goal is that by end of this session, you'll walk away with a concrete mental model on how to design platforms that communicate as quickly as clinicians who depend on them. Yeah, so let's deep dive. So here, I mainly want to focus on one truth that drives everything else. So in clinical world, time is the most precious currency. So every second matters. A short delay in knowing about a patient's deteriorating condition can completely change the outcome. The main problem is that many hospitals still rely on traditional models or communication systems like pagers, phone calls, or manual trees. For decades, hospitals relied on pagers. Uh, they tend to be, but they gave no context. A doctor would stop everything what he or she is doing, find a phone call, uh, and call back, and only to learn that it wasn't even urgent. Uh, Also, way back, some hospitals relied on phone calls or manual call trees, literally paper-based phone chains. One person would call the next and the next until eventually it reaches the right clinician. Uh, I would think that's very slow, error prone, and very risky in nature. Even today, most EHRs handle alerts like emails. They sit in an inbox for extended period of time until someone logs in and checks. Um, uh, this kind of structure might be fine for billing reminders, but for clinical care, it's quite dangerous. If a critical lab is waiting in an inbox while the clinician is on rounds, I think precious time is lost. So each of these steps really adds friction, and when patient's condition is changing by the minute or even by the second, uh, those bottlenecks can be the difference between stabilizing the patient and missing the critical window. So that's why real time communication matters, and it's very transformative. They don't just send out information, they deliver it instantly with full patient context and escalation logic built in directly to the right clinician wherever they are. So instead of waiting seconds, waiting for callbacks uh, in pager kind of technique, teams stay synchronized all the time and can act upon immediately. So all I would say is if time is currency in healthcare, real-time clinical communication system is the payment system. So it ensures that currency here, time is never wasted. So now let's jump on to see some of the pillars that are required to build modern clinical communication ecosystem. Uh, so there are main three pillars. The first is the secure messaging platforms. So these are HIPAA compliant communication tools that look a bit like texting apps, but they are far more powerful. They allow medical staff to collaborate while protecting patient privacy at the same time. Uh, the messages can include patient IDs, lab values, or even links back into electronic health record for a patient. So that way, receiver doesn't just get a vague call back or call me. They get structured contextual information that can be really useful to act upon immediately. The next pillar is the clinical alert systems. So these are the systems that generate automatic high priority notifications. For example, a lab result can go outside safe ranges, or a code blue situation, uh, like a cardiac arrest, or a patient monitor crossing a critical threshold value. So in these situations, instead of relying on manual calls, it makes sense to build an alert engine that can apply rules intelligently and instantly escalates to the right clinician, reducing delay and costly errors. And the third pillar is the mobile first solutions. This last pillar is all about ensuring clinicians can respond no matter where they are, whether they are on the ward or in the operating room or even offsite. The system is designed for the realities of mobile use, um, like making use of seamless handoff between Wi-Fi and cellular networks, or make use of efficient push notifications and interactive interfaces that work on small screens. It may sound like secure messaging and mobile first are similar, but they solve different problems. Secure messaging is about what we send, like encrypted, compliant, structured, and mobile first is about how we deliver those messages, ensuring it always reaches the medical staff irrespective of where they are. And here's where modern systems pull ahead of traditional tools like phones and pages. Uh, and you might wonder, if the recipient is busy, how would messaging solve the problem just like a phone call? The difference is that these real-time communication systems are team aware and context rich. They deliver alerts in parallel to the entire care team, tracking acknowledgements and escalating automatically if no one responds. For example, take a code blue situation. A patient goes into cardiac arrest. With pagers, you send a beep and hope that the right person responds at the right time. Uh, so you have to wait and you can expect delays there. But with real-time systems, the entire K team is already instantly alerted with patient location and the full context about the patient condition. Within seconds, CPR can begin and survival chances can drastically improve. So that's the difference. uh, Real-time communication is not just about faster communication but smarter team aware communication. So together, these three pillars like eliminate isolation and allow clinicians to coordinate seamlessly across the entire continuum of care. So let's look at some of the most dramatic benefits of real-time communication, and this can show up mainly in emergency departments and intensive care units, because these are the places where every second can change the outcome. Deployment of these systems have shown dramatic improvements. For example, 42% faster triage responses. That means patients are more assessed almost twice as quickly as before. For example, when a critical case arrives into the emergency department, an immediate alert goes straight to the triage nurse's device. So, no waiting on phone calls or no delays. Uh, so, this can mean stabilizing someone right away instead of struggling to catch up later. And other improvement we see is 89% immediate alert escalation. Instead of waiting for callbacks or paging trees, the right specialists are notified instantly. For example, a lab result showing dangerously high potassium can be pushed not only to the attending physicians, but also to the cardiology team within seconds. So, if the first line of clinicians are tied up, the system ensures that the next set of physicians are already aware. Uh, that way, it removes lots of bottlenecks. And the third improvement we see is 67% increased improvement in team coordination. In high stress environments like hospitals, miscommunication and duplicated effort are very common. Real time systems create a shared information layer to address this problem. That way, everyone sees the same alert, same timestamps, and same patient context. That way, it reduces errors caused by stress, noise, or broken communication, and helps team act as a single unit rather than individuals reacting in isolation. So these numbers aren't just statistics; they represent faster intervention, fewer errors, and more lives being saved. It's also important to uh, emphasize that these gains aren't about speed; they're also about clarity and coordination, qualities that can change the outcomes just as much as reducing response times. So let's look at some of the impact on patient outcomes by leveraging real-time communication systems. Um, so the impact is clear. Fewer medication errors because now instructions are sent out as structured, time-stamped messages with the full patient context. You can expect less room for misinterpretation. That way we can achieve. That way there are few medication errors. Uh, Another impact is shorter hospital stays. Since the interventions are faster now, they can prevent complications, which translates into earlier discharges and more efficient use of resources within a hospital. And the third impact is better handoffs, uh, with updates being logged and being shared with all the teams in real time. The uh, incoming care team can see exactly what has happened before. So that way, nothing is lost in translation. So these aren't just operational gains; they directly improve the patient recovery and reduce stress observed by medical staff, and it ensures everyone works from same reliable source of truth. So now we have seen the impact on outcomes. Now let's try to be clear. Building these systems is not straightforward. There are major technical challenges that we have to solve to make real-time communication more reliable and more safe. So one of the challenges is the regulatory compliance. As you all know, healthcare is governed by strict rules like HIPAA. So that means every message, every log, every data transfer has to be encrypted, access controlled, and auditable. Uh, so that means compliance isn't just a checkbox. It also affects the design choices at every layer of the system. So you have to make sure your systems are compliant. And the second and the second challenge is about system latency. So low latency delivery is the main target here, uh, but it's not trivial when you have to handle lots of things like serialization, database writes, um, network hops, and mobile OS background limits. So each of such layer adds delay. So the architecture has to be optimized end to end. So the goal isn't just to be fast in theory, but it has to deliver reliably under a second every single time. And the third and most important challenge is the legacy integration. So most of the current hospitals don't run on shiny green field tech. They still rely on old HL7 V2 feeds from 1980s, and they use proprietary device interfaces and rely on decades old infrastructure. So that's why one of the hardest challenge is designing and coming up with an adapter layer which can translate these old message formats and normalize them into a more modern, consistent format that real-time systems can understand. So without that, you can't build reliable communication because these input themselves are very fragmented and legacy in nature. So each of those challenges is tough on its own, uh, but together they create a perfect storm that makes healthcare IT so demanding. So let's look into the details for each challenge. Coming to the first challenge, the HIPAA compliance. Uh, so when we talk about clinical communication, speed alone isn't enough. If medical staff don't trust the system to keep the patient data safe, they won't use it or adopt it. So that's why HIPAA compliance is the foundation of trust in healthcare systems. Um, so mainly there are three pillars that make this compliance work in practice. So one of them is end-to-end encryption. That means protecting data while it's moving or while it's stored. So we can rely on some of the TLS protocols in transit to block any interception that tries to uh, read the data. Uh, and some of the AES 256 algorithms that can keep the data encrypted at rest so that it can secure databases and servers. Uh, some systems also go further with client-side encryption, where the data is encrypted before it leaves the client device, and it can only decrypted on the receiver device. Even the middlemen like cloud providers cannot read the data. Services from AWS, Azure, or Google give us some of the building blocks, but in healthcare, there are other vendors like Tiger Connect, uh, which are specialized in HIPAA compliant messaging. And The second pillar is the role-based access controls. So not every clinician should see every message or every piece of data. So access is tied to clinical role or context. For example, a nurse in a specific ward may only see alerts for patients assigned to that ward, but not other wards. Another example is like a pharmacist may see medical related alerts, but not full diagnostic reports. So that way, making use of role-based access control really minimizes risk and enforces the principle of least privilege. And the third and important pillar is the detailed audit trails. So every message and every action must be logged. So like who accessed it, when, and what they did it. Uh, these logs aren't just for compliance purpose, but they build accountability and trust within the hospital ecosystem. If there is ever a problem or you need to backtrack, the system can show exactly what happened and who is responsible for each step in the process. So without these safeguards, no matter how fast or reliable the system is, it won't be adopted. Uh, Medical staff must be confident that communication tools protect patient privacy as strongly as they deliver speed. So while these pillars may feel like overhead, they actually form the bedrock of adoption. They transform the system from nice to have app into a trusted part of patient care. Now let's look at system latency and how it really matters. So as you all know, in clinical communication, speed is everything. A message delivered late is often a message wasted. So our target is to achieve low latency delivery. So anything slower uh, risks and it might compromise the care, but that's much harder than it sounds. Let's look at how low latency can be achieved, and there are some techniques to do that. One is edge computing. So one way hospitals reduce latency is through edge computing. Instead of sending every alert or message round trip through the cloud, edge nodes can process data right inside the hospital campus. That means critical alerts can now move at LAN speed instead of WAN speed through internet, and alerts can continue even if the internet breaks down. So that way, communication around critical alerts stay continuous inside an hospital without relying on cloud-based uh, providers or their infrastructures. The next thing is network optimization. In hospitals, not all network traffic is equal. Um, a code blue alert can't afford to wait behind a normal traffic or someone streaming video on a guest Wi-Fi. That's why we kind of configure special networks for quality of service that can actually prioritize critical traffic over other normal traffic. You can think like an ambulance on the road. When the siren is on, traffic makes way, right? So that's how you can think about this situation. So the result is that urgent signals always get priority, and they get through instantly, even in a congested hospital network. And the third way of achieving low latency is like making use of failover systems. So redundancy is built into the system so that the system doesn't choke if one of the uh, nodes goes down. So alerts can automatically reroute to some of the healthy nodes through backup paths. That way you can keep the performance steady even in the failure scenarios. Another architectural component that improves latency is by making use of persistent connections such as WebSockets on uh, devices. So instead of relying on polling every piece of data from the server every few seconds, WebSockets maintains a live channel or a live connection between the client and the server that allows the system to push alerts instantly, reducing delivery time to mere milliseconds. So all these capabilities aren't theoretical. Some of the vendors already provide them today. For example, AWS offers edge computing through AWS Outposts, and Azure offers the same through Azure Stack Edge. And some of the healthcare platforms like Tiger Connect, they offer quality of service aware networking. That way, they can prioritize critical traffic over normal traffic. And some of the cloud providers also handle multi-zone failovers as managed services. Um, and they also provide PubSub support through AWS AppSync or Azure Web PubSub. That way, messages are delivered very instantly through live WebSockets. So reaching this level of low latency delivery means optimizing every step, from how messages are encoded, routed, and how quickly a phone can wake up to show a notification. It's all about shaving of milliseconds, and in healthcare, those milliseconds can really mean a difference between saving a critical life and being too late. And let's look at the third and most important challenge, that is integrating with hospital IT. Um, so even the fastest and most secure communication system might be useless if it doesn't really integrate with the existing IT ecosystem inside an hospital. So that's where the main challenge lies. Uh, Nowadays, hospitals run on a patchwork of systems. They often rely on decade-old infrastructure, and they sometimes work alongside with newer technologies as well. So integration is critical here, and it has to be done without breaking existing workflows that clinicians depend on for everyday activities. So there are a few principles that can make this integration successful, and one of them is API driven interoperability. So modern EHRs expose FHIR APIs, that is fast healthcare interoperability resources APIs. So these are RESTful interfaces that make it easier to pull and push clinical data. So these APIs can be considered as the future of healthcare interoperability, but currently adoption is low. Many hospitals are only partly FHIR enabled, uh, but uh, but we know that many hospitals are looking forward to it. So we can expect more adoption in future. And another principle is the adapter or connector patterns. Because legacy systems aren't going away soon, we need adapter patterns or adapter layers that can convert or translate old HL7 V2 messages, which most of the hospitals currently rely on, uh, and feed them into modern schema that real-time communication system understands. Think of it like a translator sitting between old and new worlds. And another principle is modular rollouts. You don't deploy your feature across the whole hospital at once. You can start small, start with a small unit, for example, ICU or emergency ward. Um, Try to measure results there, uh, try to understand feedback you get, and try to refine and then expand. So that way, this reduces blast radius and at the same time builds clinician confidence. And the next principle is the workflow preservation. Uh, Integration isn't just about technology. Um, Clinicians won't adopt it if the system actually forces them to switch apps or break habits. So the best approach is embedding alerts or messaging directly into their existing workflows. For example, inside the EHR interface, they already use very frequently on a day-to-day basis. So integration is more than API and protocols. It's about meeting hospitals where they are, um, bridging legacy with modern while keeping clinicians' workflows as seamless as possible. So now, we looked into some of the challenges. Now let's see how demands of healthcare real-time communication system can be achieved. So to meet such demands, these systems are built on cloud native architectures. So cloud native can bring several good advantages, and some of them are elastic scalability. So cloud platforms can scale up during peak loads. For example, during a mass casualty event like COVID, maybe, uh, and scale back down afterwards. So that kind of elasticity is very essential in healthcare, where we know that traffic patterns can be unpredictable. And next advantage is the high availability and resilience. Cloud systems are designed for fault tolerance. So with multi-zone or even multi-region deployments, services can fail over automatically if a data center goes down. That level of resilience is hard to achieve in an on-prem system alone. And the third important benefit is the cost efficiency. Cloud native systems also avoids expense of buying and maintaining massive or complex on-prem hardware sized for worst case peaks. Instead, hospitals pay only for the services they use. For example, in terms of traffic, like scaling up when demand surges and scaling down during quieter periods. So this makes economics of real-time communication far more sustainable. Uh, some hospitals even combine cloud native architectures with local edge nodes for ultra low latency. But the core advantages of cloud native architectures are scalability, resilience, and cost efficiency. Now let's look at some of the vulnerable points in patient care, and one of them is shift handoff. That is like when one team finishes taking care about the patient and another takes over, you can expect some critical details to be lost if they are only passed verbally or written on paper notes. Uh, but real-time communication systems help here by providing asynchronous handoff protocols that capture information consistently and make it accessible across multiple shifts. So there are three elements to this: timestamped updates. So every message or alert is timestamped and logged in sequence. That way, it can create an accurate patient timeline so that incoming team sees exactly what interventions happened, not just a summary. So they can get a clear picture of patient status and what previous care team did about the patient care. And the next element is the asynchronous communication. Um, let's say even if two teams don't overlap, the outgoing team can leave structured updates that the incoming team reviews later. So this avoids missed handoff problem that happens when shift overlaps are very short or chaotic. And the third element is the structured workflows. So instead of relying on memory or ad hoc notes, handoffs use predefined templates that can include current status, recent changes that have been done, or outstanding tasks that are still pending, which can improve the patient care. Um, so this ensures nothing critical is left out. So altogether, these features turn handoffs from risky informal exchanges into reliable traceable transitions. Uh, the result is extraordinary, like fewer medication errors, fewer missed tasks, and better continuity of patient care. So asynchronous handoff isn't just about convenience, it's about making sure every clinician starts their day or shift with a clear, concrete, and a shared picture of their patient's health. Uh, Yeah, so we have already seen the clinical impact of real-time communication, like safer handoffs, fewer errors, better outcomes. Now let's try to look at the financial side of the equation, like how these systems deliver clear economic returns for hospitals. Um, so one is reduced length of stay. So when there are faster interventions, you can expect earlier discharges. That way, it frees up bed capacity and improve throughput inside an hospital and make use of resources very efficiently. uh, you can expect fewer costly errors. Each avoided medication error or adverse event prevents downstream costs like lower insurance premiums or litigation costs or maybe malpractice claims. Um, and the third one is the improved staff efficiency. Um, since there are no pagers or phone calls, you can expect less time being spent by the medical staff chasing callbacks. So that means it lowers overtime and burnout, which reduces turnover costs. Uh, so it really improves the staff efficiency. Thereby, you can realize lots of gains. So when you add it up, most hospitals see return on investment within first year. The system mainly pays for itself, not just in better outcomes, but in stronger financial sustainability. Now let's look at how real-time communication system can be rolled out in an hospital ecosystem. So it requires a structured roadmap, and there are 5 key steps that can be followed in achieving this roadmap. One is the initial assessment. So the process starts with mapping current existing workflows. Uh, so we'll need to try to understand where delays are occurring, how alerts are getting routed, and where handoffs are uh, getting broken. This creates a baseline for improvements and ensures we understand pain points even before introducing new technology. Um, the most critical part here is understanding feedback from medical staff because they see the gaps firsthand. So we need to make sure we have updated feedback from them. And the next uh, step in the roadmap is technology selection. So once the gaps are clear and you understand them, the next step is choosing the right platform which can solve your problems. And here you mainly need to look into two priorities that matter the most. One is compliance and the other is usability. So when it comes to compliance, the system must meet HIPAA and regulatory requirements from day one. Otherwise, your patient data won't be safe. And the other thing is the usability. Uh, from usability perspective, if the platform isn't fast and intuitive, you won't find clinicians adopting to it, no matter how secure it is. So you have to find a right choice that can balance these both. And the third step is the pilot deployments. So whenever you're ready with a small feature, instead of rolling out across the entire hospital, you start with small acuity units like ER or ICU. These areas show the clearest benefits quickly. Pilots allow hospitals to quickly validate the integrations, measure the impact, and refine workflows based on the feedback before they can expand it further. And the next is the phased expansions. So once the pilot proves successful, the system can be expanded department by department. Um, that way you can roll out your feature in a stepwise manner. So each rollout in a department can incorporate lessons learned from the earlier stages. That way you can reduce risk and build the momentum going forward in order to achieve a successful deployment. And the fifth yeah and the fifth pillar is training and adoption. um, So technical deployment is only half the battle. The actual real success comes from adoption. So that means you need to train clinicians, you need to run lots of simulations, and try to embed the system into their daily routines until it feels like a second nature. So when adoption takes hold, real-time communication really becomes part of the hospital culture. So this staged approach minimizes disruption. It tries to build trust among medical staff and ensures that the system doesn't just go live, but it eventually succeeds. So let's look at some of the lessons learned from real world deployments. We can look into three lessons that really stand out. One is adoption. So the system only succeeds if the frontline staff use it. So that means you need to involve them early, listen to their feedback, and prove them that the system can really reduce their workloads. And the second is training and cultural change. Um, so this isn't just a tech upgrade. It's a shift in how care team communicates. Moving from one-to-one paging to team-based collaboration takes time, and training and champions who can lead by example as well. And the third is the iterative refinement. Uh, no rollout is perfect on day one. So you have to go through pilots, f- uh, take feedback from different people, and then work on it, and then slowly improve your refinements. That way you can build trust and ensure long-term success. So hospitals that treat real-time communication as an ongoing system, not a one-time project, uh, so they see the most lasting improvements, in my opinion. So yeah, coming to the conclusion, so we have covered a lot today. Why real-time communication matters, how the architecture works, and what safeguards keep it secure, and how hospitals have learned from real-time deployments. So if there is one takeaway, it's this: real-time communication isn't just an IT infrastructure; it's a clinical intervention. Uh, so when the communication is fast and secure, patients do better. When integration is seamless, clinicians actually use it. Um, when deployment is thoughtful, hospitals see both clinical and financial gains. This is more than just upgrading tools. It's about reshaping how care teams work together. Communication has to be as reliable and immediate as the clinicians themselves. So uh, finally, to say, whether you look at it through lens of technology or patient safety or hospital economics, the message is clear. Real-time communication saves time, reduces errors, and saves lots of lives. Um, yeah. Um, Thank you. That's
Thank
it.
you.
I would happy to take some questions.
Yeah, thank you, thank you very much, Akhilesh, for this insightful presentation or architecting real-time clinical communication for better patient outcomes. I have learned a lot as an architecture, and it was a great overview of how technology, compliance, and also innovation comes together to truly improve patient care. So we
Sure.
now move to the Q&A part of the session. We have many questions. We cannot tackle all the questions. We will take the question in order and address the most relevant ones.
Hmm.
But maybe after the session, you can reach out, Akhilesh, if you have any question or if you need more detail. If you
Sure.
are okay, thank you. So I don't know if you can see the chat. I
Hmm.
have put some of these questions. You have a choice. You can take them on
Okay.
in order or the most relevant. It's up to you.
Okay, sure. I'll go one by one. Why is
Okay.
real-time communication becoming such a critical factor in modern healthcare today? Yeah, that's an interesting question. So as you can see, there are critical times where clinicians expect information to be instantly delivered. Let's say in ICU or emergency units, you need to know critical alerts about the patients in real time. Otherwise, you'll miss out on important updates, and patient might be in a critical situation. So the survival rates can be dropped. So that's why real-time communication uh, uh, is an uh, is becoming a critical factor in modern healthcare today. And the next question is traditional versus modern systems. What are the main limitations of traditional tools like pagers compared to secure messaging? Um,
Yeah,
yeah,
it's a tricky one, this one.
yeah, yeah. So with pagers, how they work is they try to beep and they expect a callback. So whenever clinicians are busy, uh, e- even if they are not busy, it takes time to respond back. But with instant messaging, you can easily respond back in milliseconds, right? So that's where real time communication is more advantage when compared to pagers. Also, not just about calling back, pagers cannot include additional context like um, uh, status updates or any additional context about the patient. But real-time messaging can be context rich. So where you can expect everything to be delivered in one single message, and you can instantly look at patient's electronic health record. That is something not possible with pagers. Modern clinical communication ecosystem. Which of these technologies has shown the fastest adoption uh, in hospitals? Um, so it's not about one technology, I would say. In order to build a reliable real-time clinical communication system, we need all the three, because when it comes to secure messaging, you need to make sure the data is protected and HIPAA compliant. Otherwise, medical staff won't even adopt it. So that is important. And the other two are really important, like alert systems, uh, which is very important in cases like ICU or emergency units, where you need to deliver messages instantly. And the mobile first solution is also important, because you can expect doctors to be offline sometimes, but they still use their personal mobile devices. So developing consumer apps will be really helpful. That way the communication is 24 by 7 and they can be reachable every time, even when they are offsite. So I would say all the three technologies are important, and they have shown fastest adoption in hospitals.
Okay,
Hope
sure.
I answered it. Yeah.
Yeah, yeah. Oops. Thank
Why
you.
do you think critical care environments benefit the most from these solution? Because that's where every second actually matters. Uh, you need to get the messages or alerts very instantly. That way you can improve the patient care in a proper manner. So that's why you see most cases. It's not just about ICU or emergency units. These
Hmm.
real-time communication systems are useful in other workflows as well. Like whenever a patient admits, you need to be quick and understandable. Try to understand what their exact situation is. That way, the triage nurse can immediately start the care. And it's also useful in monitoring administrative workflows. That way, everything is seamless and continued in real manner.
Yeah, great.
So the next is impact on patient outcomes. Which improvements in patient outcomes do hospitals typically notice after first deployment? Um, I would say uh, reduced hospital stay, because whenever the information is delivered in a fast manner, you can expect care team to work in a very quick manner. So that way, whenever a patient comes in, he's quickly addressed, all the problems are handled in an efficient manner, and he or she is discharged very quick. So I would say, yeah, reduced hospital stay is the main outcome that I can expect.
Okay, great. Thank you.
Technical challenges. From your experience, which technical barrier is usually the hardest to overcome? Compliance, latency, or legacy integration? It's a good question. I would say legacy integration, because you never know. Each hospital can be unique, and
Hmm.
they can follow custom integrations when handling their patient data. Uh, so you have to come up with custom adapters. That way, it can work with unique hospitals in its own manner. When it comes to other two barriers, they are technologically viable and they are known problems in the current world. So you even though they are hard, we know how they can be achieved. But as far as the legacy integration goes, it depends on the current use case and how current hospitals are set up and how their legacy architecture really works.
Yeah. The next is very technical ones.
Yeah. How can a real-time clinical communication system be architected to handle such sudden spikes in demand, for example, during mass casualty events without compromising performance or availability? Yeah. So that's where you leverage cloud native architectures. Let's say AWS or Azure or Google Cloud. Uh, so they provide elastic scalability. That way, even in the times of huge traffic, they can scale up or down based on your traffic needs. uh, yeah, so that's how you can address
I can
those
leverage
critical
on
traffic spikes.
so I can leverage on cloud computing for this.
Mhm.
Good. Thank you.
Integration, what best
Yeah.
practices do you recommend for integrating these tools with existing uh, EHR systems? Yeah, so I was covering some of the adapter technology in one of my slides. So when you try to integrate with such systems, first try to understand how the existing message format is and what kind of schemas they are using. That way, you can leverage those adapters to transform the old messy data into more modern format that real-time systems can understand. So mainly leveraging adapters or transformers to really achieve this. So uh, also more hospitals are now adapting FHIR enabled APIs. So that's the new way of message standard within healthcare world. So you can build uh, a custom translation logic to work with new FHIR based APIs. Why is cloud native design so important for future proof healthcare communication? Yeah, as I called out, there are lots of advantages when you use cloud native architecture. One is scalability. When you see critical traffic spikes, you can easily adjust to the load. And the other is failover, fault tolerance. So even in scenarios like failures, you can expect the traffic to be still handled by backup nodes. That way your system is always consistent across any given scenario. Not just those two advantages, you can also look at the cost benefits, because currently cloud providers, they cost based on usage. So if you see usage during sometimes, you'll only be charged during that times, and during other periods when you see low usage, you will be charged less. So paper paper usage is really interesting, and you can really benefit from cost analysis with respect to cloud native architectures. But with respect to on-prem systems, you cannot really achieve this because they are fixed architectures mostly. So yeah.
Good.
Yeah, and the next is roadmap for deployment. What is the biggest lesson learned when moving from pilot deployments to full-scale rollouts? Um, So the biggest lesson I would say is uh, every single unit can behave differently and unique from other units. So whenever you deploy something uh, in one single unit, it may work, but it may not work in other units, which can be unique and different from previous units. So those are the lessons that you need to keep in mind. So you have to architect and develop your feature that way, so that it can work with all of your units. So whenever you roll out, you make sure there is less blast radius. So it can be done in an iterative manner. You monitor lots of metrics, try to understand the impact, and then refine it based on the feedback you get.
Okay, thank you. The last one, but only
So the last question is cost benefit
the
analysis.
fit analysis. Yeah.
Sorry, Roderick.
Yeah, I would say the last one is about money.
Yeah. Do hospitals usually see financial benefits right away, or does it take time to measure ROI? They might not see the financial benefits right away. I mean, it takes time because it's a new
Mhm.
system that needs to be adopted, um, well monitored, and
Yeah.
proper impact analysis has to be done before you call out this is useful or not. But as far as the long term gains go, they really benefit from the net ROI. Uh, After taking considerations like it improves uh, existing medical staff in terms of workload or stress, or freeing up bed capacity pretty soon. That way, your resources are used very efficiently, and yeah, other advantages as well.
Okay. So thank you again. It was the last question. So thank you all for joining this Archie Friday session. A special thank you to our speaker, Akhilesh Volan, for sharing such valuable insight on real-time clinical communication and impact on patient outcome. I learned a lot and thank you for that. We hope you found the discussion inspiring and useful. Stay tuned for our next Archie Friday session, and until then, thank you once again for being with us today.
Yep.
And
Thank you so much for giving this opportunity, and I hope this session was useful to audience. So yep, I look forward for more sessions in future. Thanks.
yeah, believe me, we will have a big session in Paris. I hope you will join us at this moment.
Yes, sure.
So thank you once again, Akhilesh, and bye bye, everyone. Take care.
Thank you. Bye.
Bye.